We are live. We are live. We're live. I'm Dr. Frita, and guess what? It is Medical Monday, where we give you all of the hot health topics in the headlines. And we've got plenty as usual. Make sure you go ahead and click that like button and share, because I'm about to give you some evidence-based medicine that's in the headlines. We're going to start off with our myth versus fact. You may have seen these viral videos. The question is, does Mucinex help you to get pregnant? Myth versus fact. We're going to address it. I'll give you the evidence behind it. And then we'll get into your weekly dose of medicine in the news. Let's talk about Adele. Y'all know Adele and all of her songs. Hello, which kind of sounds like Lionel Richie. But anyway, Adele shared that she had a health scare that hurt worse than childbirth. And for those of y'all who have had babies, you know how childbirth hurts. So we'll talk about Adele's health scare. And then we'll talk about McDonald's. I'm loving it. Well, guess what? There was an E. coli outbreak from people who ate the quarter pounder at McDonald's, and it led to one teenager getting kidney failure. Today, we'll talk about the connection between E. coli and kidney failure. And then we'll talk about Rachael Ray. Speaking of food, well, she was on a video, and fans noticed what they said looked like slurred speech. They were accusing her all kinds of things. Some said she had substance abuse. Some said they thought she was having a stroke. We'll address it and what's going on with Rachael Ray's health update. And then we'll talk about the stallion, the hotties. Y'all know Megan Thee Stallion. She stays in the news. And yes, I'm a Megan Thee Stallion fan. But guess what? She's talking about dealing with mental health. And I'm glad she's bringing the conversation to the forefront. Afterwards, of course, we'll have our live Q&A. So go ahead and get your questions ready. I'll be answering them right here live and on stage, because we're about to have medicine in the news. I'm Dr. Frita. Hit that like. I'll see you on the other side of the intro. All right, y'all, we're live. I'm Dr. Frita. Go ahead and hit that like and share. It lets YouTube know we're here. We're giving evidence-based medicine, because today is medicine in the news, talking about all of the hot health topics in the headlines. I'm not doing it alone. My co-host, Shador, and my practice manager, please come on up to the stage. Hey, Shador, how you doing?
Doing well, Dr. Frita. How are you?
I'm doing really, really well, because I just got back from my daughter's school's homecoming. Y'all know my daughter goes to Florida A&M University, the HBCU, and she is a part of the best marching band in the world, I say. And many others agree with me. She's a part of the Marching 100. She's a trumpet. And so I was able to go there, see her play. They did really well. I got a chance to fellowship, see all kinds of friends. I had a good time. Shout out to Rachel, who sat to my left, John, who sat to my right, my new best friends. Anyway, so I had a really energized weekend. And then, of course, came back, did sports stuff with the kids. Sports really run my weekend. But I had a great weekend. I hope you had a good weekend. I hope you had a restful weekend, Shador.
Yes, our weekend was full of recovery, as you know. Last week was, a little under the weather, but doing much, much better today. Sound better today, I think.
You do. You sound much better. You sound like people who actually take Mucinex, which gets us into our first story, Shador. Myth versus fact. Myth versus fact. But first, let me see who's the first person in the chat today.
Yes, ma'am. First person today, we have our own Planet Life. Hello.
Hey, Planet Life. Welcome. Welcome back. All right. Planet Life and everyone else in the chat. I have a question. Myth versus fact. Can Mucinex help you to get pregnant? Put an M1 if you think that's a myth, like that's not true. Put an F1 if you think it's a fact that Mucinex may help you to get pregnant. And, as you answer, if you're not sure what Mucinex is, let's go ahead and play this clip. I'll explain what Mucinex is, and then we'll revisit the question.
Got chest congestion? Blast out mucus with Mucinex 12-hour and treat the cause. Got chest congestion?
All right. So Mucinex is guaifenesin, okay? And what that is a medication that helps to thin mucus or thin phlegm. And so if you're someone with a cough or congestion and you just feel like you have mucus or phlegm in your chest or in your upper airways, we do know that the Mucinex or the guaifenesin can help to thin that mucus, okay? Put a 1 in the chat if you've ever used Mucinex, if you know of someone who's used Mucinex during a cold. All right. So Mucinex has been around for years, and we do know that it gives a clinically significant improvement in helping with cough congestion and thinning the mucus in your upper airway. But here is the question, because this has been going on social media. You have many, many videos with millions of views at this point where you have couples saying that when the woman took Mucinex, even women who've been having fertility issues for months and for years, you have these different testimonials where they're saying they took the Mucinex and then they got better. As far as their pregnancy, they said they took the Mucinex and then they were able to get pregnant. And the theory behind it is the same way that Mucinex is able to thin the mucus or the phlegm in your upper airway. The thought is that perhaps it can also thin the cervical mucus or the mucus that's in your cervix and the people born females' reproductive system. It thins that mucus, this is the theory, allowing sperm to get through the cervical mucus more easily and allowing women to get pregnant. So first off, did anyone put a 1 where they've used Mucinex or they know of someone who's used Mucinex?
Yes. And Dr. Frita, before we go, there's a couple of med heads that I want to shout out really quickly for joining us. Miss Gail, hello.
Hi, Miss Gail.
And Miss Kim.
Hey, Miss Kim. Welcome back.
Miss Kim says M1. She believes it is a myth.
All right. You want to be skeptical already. First thing in the live. Okay. So you don't believe that Mucinex can help you get pregnant. Listen, y'all, I must be like, I don't know what my problem is. I love these games. Myth versus fact is like my favorite. All right. M1. We'll see what comes of it. Anyone else with the myth?
Probably put ones, Dr. Frita. So Ronnie, hello, says myth.
What? Okay, myth. You don't believe it. But the videos have gone viral. There are millions of views of ladies who say that Mucinex changed their lives. They took the Mucinex, their cervical mucus thinned, and voila, they were pregnant. All right, who else?
TS. Hello.
TS said myth.
TS says myth.
Now I'm gonna tell you the truth. TS is usually right, but we'll see if you're right today, TS. All right, who else?
Coley, hello, Coley. Coley says probably clear mucus from fallopian tubes.
Okay, getting a little scientific here. Y'all, I need to stop. I'm telling you, I love this game. Does anyone say it's a fact that the Mucinex can help to clear the mucus and to thin the cervical mucus and help you get pregnant?
No facts at all.
Y'all some skeptical people. All right, myth versus fact. Okay, so let's talk about the anatomy a little bit, because you mentioned something also with the fallopian tube, which is really interesting because we know that the fallopian tube is where the fertilization takes place, right? The sperm, goes through the cervix, through the uterus, fallopian tube, and it meets the egg, and voila, we get everything started. So if a lady has very thick mucus, okay, really viscous, thick mucus, then, it makes sense that it would be more difficult for the sperm to penetrate. But if the cervical mucus is nice and thin, then it'll be easier, theoretically, right, for the sperm to penetrate. And so in theory, some of these viral videos we're seeing, well, it seems like it would make sense, right? It seems like it would make sense. And, would people actually go and do a viral video that's not true? Would they lie about something as serious as fertility? Well, I wouldn't use the word lie. Folks really may be getting pregnant after Mucinex, but the issue is we don't know if it's because of the Mucinex, right? We don't know if it's coincidence or just a correlation. And so in cases like that, if we don't have definitive scientific studies, it's hard to say yay or nay. Well, guess what? We actually do have a scientific study, but the one that most people refer to is like from 40 years ago. It's from 1982. There were 40 couples in the study, and they were studied over 10 months. And back then, they used guaifenesin. I don't know if it was called Mucinex. I don't know if that name was out, but it was still the same drug, guaifenesin. And the females in the study took 200 milligrams of guaifenesin, the same as Mucinex, 3 times a day, starting day 5 of the menstrual cycle, all the way up through ovulation. And of those 40 couples, 2/3 were able to get pregnant. Okay. And the issue is we still don't know if it is because of the Mucinex or if there's some other reason. Now, theoretically, and even in the study, when they studied cervical mucus, in some cases, the cervical mucus was thinner, but there was no definitive data to show that there was a correlation with the sperm being able to go through. So the bottom line is that for all of you little skeptical med heads, yes, it's a myth, only because we don't have any proven data to say that the Mucinex helps. Just because you don't have data to prove it, does it mean that it doesn't help? Not necessarily. But what I can say is thus far, there's no scientific data to prove that Mucinex helps with fertility. There was another study done a little later, and kind of the same thing, where they did a study and they tried to look at sperm motility. And again, it was inconclusive. There was no data to prove that the thinning of the cervical mucus helps. So we don't have data to officially support it. So then the next question is, okay, so is that a maybe? Like, could Mucinex help you get pregnant? Like, is it possible? Here's the most important thing. What they found was that the Mucinex did not hurt. They did not find it to be harmful to the fetus. In fact, Mucinex is considered to be one of those pregnancy category C drugs where there's been no data in human fetuses or animal fetuses to show that it harms the fetus. And so there are many physicians, many obstetrician gynecologists, OBGYNs, who say that if you do use Mucinex, it is off-label. There's no science to prove it. And there's no definitive data showing that Mucinex will hurt a fetus. So they're not telling you not to, but they're also saying that they cannot, there's no scientific data to support it. So basically, might hurt, could be, maybe, no data to support it. So when you use it, or if you use it, then you can't say that there's scientific data to absolutely prove it. Bottom line, after all of my talking, what I'm saying is that those of you who said myth are correct. But here's the really important thing. Even when using over-the-counter drugs, make sure you consult with your physician, because for some of you who are trying to get pregnant, your physician might tell you, hey, there's no data to support it, but you can go ahead and try it. It won't hurt you. But some may say there's no data to support it. And for whatever individual medical reason, your doctor may say, don't take it. So please don't take any medication, even if over the counter, without consulting with your physician. All right. So we'll close out this myth versus fact. It is a myth, but let's just play a word from someone who is actually in a fertility clinic, a professional, and see what she has to say.
So the thought behind taking Mucinex while you're trying to conceive is that it can thin cervical mucus like it thins secretions in the lungs when you're sick and congested. However, there have been multiple studies done and no one has ever been able to actually prove that it does boost fertility. But if this is something that you are considering, just make sure you chat with your doctor first.
So it sounds kind of like the same thing. Won't hurt, might help, consult with your doctor. All right, that's fun. No more guessing games for now. No more guessing games for now. Were there many ones and people who have used Mucinex before? Or no people?
So Miss Rosalind, hi Miss Rosalind. She says my husband used it for a season. Probably around the season that we're in, transitioning and whatnot.
Yeah, and it's something, even before the Mucinex, when I would just prescribe bifenacin, that I've used in patients. And it's especially helpful for patients who don't have like a strong cough, and it's hard to get the mucus up, because if that mucus settles, it can lead to pneumonia. It can lead to sinus infections. Oftentimes they may start off viral, but if the mucus is just sitting there, you can even develop bacterial infection, like a bacterial pneumonia or bacterial sinusitis. All right. So now let's get into our weekly dose. And let's start off with Adele. Adele, put a 2 in the chat if you consider yourself an Adele fan. And let me go ahead and put my 2 up here. This is my chat. Oh my gosh. What was that album? Her first album was 19. She was so young, but her voice was so strong. And she sang like someone who had just lived decades and decades of experience. She just has a gift. She has a very wonderful voice. And, her aesthetically, she looks a lot different now. Her weight has changed dramatically. she still has a voice. Sometimes people will theorize like, I don't like people when they look different, when they change what their weight is. Because I remember for Luther Vandross, when he would go up and down, you had people who said, I don't like how skinny Luther sounds. People just get on my nerves. We need to leave folks alone sometimes. But I definitely love Adele's voice. And we know that she's been singing in Las Vegas. And just recently she was in the news because she saw Celine Dion and got really emotional because, and we talked about it here. After you finish watching this live, you can go back into our replay and you'll see where we talked about Celine Dion and stiff person's disease with which she's been diagnosed. And so we talk about that. But do we have any twos? Anybody an Adele fan?
Yes, absolutely, Dr. Frita.
Who are my people?
Miss V.E. Hall, hello.
V.E. Hall, welcome back.
S.M. Sparky.
Wonderful.
Tara.
Hi, Tara. Me too.
Miss Margaret says, not a fan.
You know what, Miss Margaret? Okay, well, you know what? I'm still your fan, Miss Margaret, but I love me still.
Yes, ma'am.
All right. Y'all put in the chat what your favorite Adele song is, but let's go ahead and talk about her health scare. Let's roll this clip.
All right. One moment, please.
And I actually have an ear infection, which is pretty grim. I've never had an ear infection before. It's in this ear. And it is the most painful thing that's ever happened to me in my life. It was worse than childbirth. It was, and it's a rare water bacteria that is very hard to treat. So I was on the wrong antibiotics for a few days, and they managed to give me one that started to work. I'm no longer in pain, which is great. I'm a bit deaf in my left ear, which is why I was left taking monitors out and stuff like that. But no way I was missing this fucking show. Absolutely.
Okay. So in the headlines, this hot health topic in the headlines, Adele was saying that it's her health scare hurt worse than childbirth. So when she said that, I was like, oh, this must be serious and really life-threatening. So I will admit, I was a little surprised to find out that this health scare was an ear infection. But the health scare was an ear infection. But let's talk about ear infections, or otitis media is what very often they are. I don't know which kind she had, but an ear infection or otitis media, which is a common one. And, oftentimes children will have ear infections. And one of the reasons that children are more susceptible to ear infections is the way that their ear canals are shaped. Okay. So as you get older, your ear canals, okay, you've got your ear, and then you've got your auditory canal, your ear canal. And when you're older, things kind of slope down, and mucus and everything that comes in through your middle ear is able to drain nicely. But when you're a kid, the angle is different, and you have an issue sometimes with ear infections. Also, if you ever notice on an airplane how the people who are usually screaming and get pain in their ears, their middle ears, is usually kids. And it has something to do with the way that their ear canals are angled and shaped, where they have a more difficult time equalizing the pressure. But of course, as you see with Adele, adults can get ear infections too. So when you have otitis media, that means that the infection is in the middle ear, meaning it's behind the eardrum. And so the way that doctors are able to tell is that they use an otoscope. And if y'all been to the office, especially if you've taken your kids to the pediatrician, the otoscope is a device where your doctor actually looks inside of the ear canal of the child. Most kids don't like it. Y'all know, before doing adult nephrology like I do now, for those of you who are new, I am Dr. Frita. I'm a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. Prior to doing this specialty, I actually did a double residency in med peds, internal medicine and pediatrics. And then I became board certified in internal medicine and pediatrics. And this was at Georgetown. And so, of course, I would see patients in the pediatric clinic. And so I had to be really creative to get these babies and these young kids to let me stick this doggone machine in their ear. And I remember at that time when I was training, Elmo was very popular. There were different cartoons, but one of the ways I would get the kids, I'd be like, "Ooh," I was like, "I heard that Elmo is in your ear. Do you think he is?" And they'd be like, they look at their mama, or they'd be like, "Maybe." And so I'd be looking, and they were anxious for me to look and see if Elmo was in their ear. Anyway, okay, that's just a walk down memory lane. But when you look in the middle ear, spoiler alert, you won't find Elmo. But what you will see with the physician, what we see literally the eardrum, okay? And we blow a little air in it, right? We blow a little air in your ear. And if the eardrum moves nicely, kind of a little bit in and out, then we're like, okay, good. you likely don't have a middle ear infection. But if we see that that eardrum is stiff, or like it's full of fluid, or we can see that there's like pus behind it, that lets us know you have a middle ear infection. And, you know, and especially if you're having fever, symptoms, pain, we treat you with antibiotics. And, you know, typically you're able to get well pretty quickly. Sometimes, even if you're not having fever or active infection, then you might just have fluid behind the ear or an effusion. Okay. And in that case, if the effusion is long lasting, if it stays there, it can cause a complication. Put in the chat what you think a complication of a middle ear effusion or fluid behind the ear chronically. Put what you think might happen if someone has that. But yeah, but in her case, the fact that she was saying that it was painful, like childbirth, she probably had a whole lot of pressure behind that ear if she had otitis media. Well, another type of ear infection, of the middle ear infection, otitis media, is otitis externa. And that means that the infection is on the other side of the ear canal. In other words, it's not between your head and the eardrum, but it's between your eardrum and the outside world of the ear. Okay. And that tends to be very painful. And oftentimes, if you try to put the otoscope in the ear, the patient will jump because that pain is right there. Okay. In the external ear, otitis externa. And oftentimes we'll call that swimmer's ear. Okay. Because that you might get, she's mentioned that she had a water bug. So sometimes you can get a bug like Pseudomonas. Oh my gosh. And if that's what she had, it is hard to treat, but you can get that in the outer ear. So I don't know if hers was otitis media or otitis externa. Either way, it can be very painful. And in her case, she said it was like childbirth. I don't know. That's what she said. And she said she had a complication. Did anyone put what a complication could be if you have just fluid in that middle ear?
Yeah, so we have a couple of chime-ins.
Ooh.
So Roni says hearing loss.
Exactly, Roni. Exactly. And you heard her say that in her left ear, she's like, I'm a bit deaf in my left ear. So hearing loss can definitely be a complication. Anyone else get it?
Yes, Keela. Hello, Keela.
Welcome.
Says dizziness.
Now that's true. Oh, I'm glad you said that, because sometimes these middle ear infections can affect your balance in your vestibular system, right? And so you oftentimes will see someone get an ear infection and then they get a vertigo or Meniere's disease, okay? And so that's true. That could be a complication of an ear infection. That's a good one. I wasn't even thinking about that one right now. Yeah. Oh, I like it. Thank you. Mm-hmm.
Yeah, speaking of the off balance, Miss Rosalind and Miss Linda also said off balance or loss of balance.
All right, same concept. That's exactly right. That's why I like my med heads. I wasn't even talking about that. I was just talking about the hearing loss, but you're exactly right. You can get off, you can have an issue with the vestibular system, and you can get, a vertigo, be off balance, and it can oftentimes happen after an ear infection. Oftentimes a viral ear infection can do it. But in the case of hearing loss, go ahead.
Ms. Kim, she says infection to the ear, nose, and throat.
So they're all connected. So yeah, so you can have a middle ear infection and you can get a connection, ear, nose, throat infection. It's possible. Oftentimes, but usually it'll be self-contained if it's in the middle ear, or if it's otitis external, it'll be self-contained. But you're right, all of these systems are involved. That's why, have you ever had, and put a 3 in the chat if this affects you, if ever you've had like a conjunctivitis or an eye infection, and you put the eye drop in and then you get a bad taste in your mouth, that just lets you know head and neck is so connected in so many ways. Put a 3 if anyone's experienced that, doing an eye drop or something like from conjunctivitis, for whatever reason, you're doing some kind of an eye drop that you have to do and you get a bad taste in your mouth. So there's a connection. There's a connection. I've definitely had to do eye drops and things like that at the ophthalmologist. And I'm like, yeah, that's how I look when it happens. Yeah.
TS, Dr. Fisher.
What TS
says? We also watch TS. So TS says can mess with the 3 little bones in the ear and can cause scarring leading to loss of hearing.
Absolutely. Absolutely. So she mentions being a bit deaf. Hopefully that once her, everything is completely treated, her hearing will come back. But I'll share, so my son, y'all know I have 14-year-old twins, a boy twin and a girl twin. And listen, y'all, my boy twin, Gregory, he really makes me laugh. I was looking at some of my YouTube videos. Yes, I look at my own YouTube videos because I was kind of going back and looking at a recipe. If you go back after you finish this live and look at my video, The Truth About Kidney Detox, where I'm talking about fruits and vegetables and smoothies that are good for kidney health, at the end of that video, I have my son Gregory come in. This is a couple of years ago, so he's gotten much bigger than that now. He came in, he helps him with the video. He's cutting the bananas. He's like his mama. He likes to talk. He has all kinds of input. Anyway, watch it. It's actually quite funny. His reaction to the smoothie. He got on my nerves. But so when Gregory was a kid, he's the only boy. The other two are girls. He has a twin girl sister and then an older sister. My girls, they've always been pretty well behaved, really good listeners. But when he was little, poor child, he used to get in trouble because he would not really be responding to what I was telling him, when he was like 3 years old, 4 years old. And I'd be like, boy, you heard me. He'd be like, Ma, I didn't hear you. I'd be like, you heard me, and so I'm fussing at the child. Took my child to the doctor, ear, nose, throat. Okay. And I took him because even though he and his sister were really skinny kids, they would snore. I'm talking about call hogs, loud snoring. And it's because they had really, really huge tonsils creating an obstructive sleep apnea, right? And so they had tonsillectomy, adenoidectomy, tonsils removed. But of course, it's an ear, nose, throat doctor who did that. So of course, she checks the ears. Checks my child's ears, both his ears full of fluid. So behind his eardrum, he had fluid, okay? Those eardrums weren't moving when she would put the air in, and she could see the fluid making them bulge out. Well, he wasn't complaining of pain, didn't have fever. So I'm like, oh, Lord, I don't win Mother of the Year for this one. So then, she takes him to do a hearing test. Child failed the hearing test. So all this time, I'm fussing at my child. You heard me. You need to start listening. You don't listen. And my child had hearing deficit due to the fluid behind his ears. Fast forward, he got the tonsils out, adenoids out. He also had tympanostomy tubes or tubes put in his ear. Went back for follow-up, passed the hearing test, and guess what? His behavior got better because he could actually hear me. Now, that joker ignores me now sometimes. He's 14. Now, I still think he hears me now. But honest to goodness, just a note to the mamas so that y'all can win Mother of the Year, even though I didn't win it that year. If you have a child who doesn't listen in school, who doesn't listen to what you say, and you're constantly fussing, and he says, oh, Mom, I didn't hear you. I didn't hear you. Take your child to the doctor to make sure that you don't have the situation like mine, where my child actually did have a hearing deficit due to fluid in his middle ear. All right. I'm sharing my story so you can be better. All right. Do we have any threes? What was my question for the threes? Oh, anybody who ever put eye drops in the ear or any kind of medicine and they taste it in their mouth. Anybody? Yeah. Oh, really? Oh,
Ooh, Dr. Fisher. So Miss Melody, hello.
Hi.
JT.
Hi, JT.
Miss Leland.
Also, a lot of people have experienced that. Yeah, it's weird, isn't it? But to the point of, who was that? The point of the, just talking about the connection in the ear, nose, throat, and even the eye, it's all connected. Very cool. All right. So if y'all have any questions, you want to talk more about ear infections or things like that, then we'll keep moving. But we will, if we have a chance, then we'll hit some of the questions for the live Q&A at the end. And remember, we'll do a short Q&A as we do for every one of our Medical Mondays. But if you want to have a full session of Q&A, then make sure you join our membership. You can click the link in the description. For the membership, you have access to members only videos that only you see. And then also for the videos that I release, then you'll get first look. My most recent video that I released is the top 10 drinks and juices to help to repair your kidneys. Top 10 drinks and juices to help to repair your kidneys. So you can check that out after you finish this live. But in cases where you're a member, then you'll get first look at a lot of videos. And then again, you'll have members only videos. And then once a month, we have the members only live Q&A where we go back and forth. We just literally have dialogue and you get a chance. And, and again, for those of you who are new, I'm a board certified kidney doctor, high blood pressure doctor, and I have also received certifications in internal medicine, pediatrics, and most recently obesity medicine. And so, yes, I like to have fun. Yes, I like to laugh, but I also give evidence-based medicine. That's what I do. That's what I love to do. And hey, if you join the membership, then you'll get a little bit extra. And don't worry, if you don't join the membership, we're going to still keep giving you the evidence-based information that you love. And right here on the Dr. Frita channel, I want to thank everyone who supports us because we're up to over 800,000 subscribers. We're on our way to 1 million subscribers, y'all. So make sure you like this video, you share it. And if you haven't subscribed already, I don't know why you haven't. Join the party. I give evidence-based information. Yes, we have fun with these weekly Medical Mondays where I give you these lives, but I also have a lot of content where I'm giving you just really good evergreen information. I'm talking about kidney disease. I'm talking about high blood pressure, cholesterol, heart disease, lupus, kidney stones. I'm talking about, the C19 virus. I talk about immunity. I talk about the truth about vaccines. You name it. Look, I even talked about Addison's disease, and we had a president who had Addison. Do y'all know what president back in the day who had Addison's disease? Very famous last name, political last name. If you know what president had Addison's disease, put it in the chat. All right. Let's move on to our next weekly dose, shall we?
Yes, ma'am.
All right. Da 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 da. I'm loving it. McDonald's. Okay. So we know that at McDonald's there was an E. coli outbreak, right? The bacterium E. coli was found for people who ate quarter pounders with cheese or quarter pounders. Okay. And we know that at least 90 people have been infected with E. coli that's been linked to McDonald's in at least 13 different states. But here's something that came out. One teenager, a 15-year-old girl, actually developed kidney failure, and it's believed to be related to the E. coli that she got from eating the quarter pounder. She ate 3 quarter pounders between September 27th and October 8th. They tested her. She was found to have E. coli, and it's linked to McDonald's. I will say that the source was not the beef patty, okay, in the quarter pounder. The source was found to be slivered onions. Let's roll that clip, and we'll talk more about the E. coli.
We're now hearing from the 15-year-old girl who is suffering kidney failure after contracting E. coli from eating the McDonald's quarter pounder. Camberlyn Bowler has been under 24-hour care at Children's Hospital for almost 2 weeks. The Grand Junction teenager ate a quarter pounder 3 times between September 27th and October 8th. She says the burgers were easy to grab while watching her school teams play. She started to feel sick, and when she texted her mom that she had blood in her stool and urine was vomiting blood, her mom took her to the hospital. Doctors told her it was a stomach bug. A week later, she was still experiencing a fever, vomiting, diarrhea, and painful stomach cramps. So she returned to the emergency room, and that's when blood tests showed the high school freshman had acute kidney failure.
It hurt to walk, like I couldn't stand up straight. Because my back was hurting really bad, and I had really bad cramps or abdominal pain I think that's what it's called. And I just couldn't get out of bed. I couldn't eat. I couldn't drink. I was surviving on popsicles, and that's pretty much I felt like crap.
Well, now Camberlyn and her mom are worried about long-term damage to her body and how much it'll cost to recover. They have retained a lawyer who's representing a number of other victims. Tonight, a class action lawsuit has also been filed against the fast food chain.
Oh my goodness. Let me tell you, McDonald's is one of the most successful businesses, right? And it has some of the best marketing because from the time, even before children can talk, they recognize those golden arches, right? McDonald's, and the different little songs stick in your head. I mean, I remember songs from decades ago, like back when they had, what was it? The McDLT. They had people dancing because they kept the hot side hot and the cool side cool because they had the lettuce and the tomato and the cheese on one side and the hot burger on the other side. And so I'm just telling you, the marketing is great because you would think I'm obsessed with McDonald's. I'm really not. It's good marketing. And I say that to say, with that name recognition and with the money and with all over the world being able to go to McDonald's, we see that that's where the class action suit is. But as I said, it's actually not the burger, okay? Because, the recommendation for when you're cooking meat is for the internal temperature to be at least 160 degrees Fahrenheit. McDonald's cooks their beef patties to 170 degrees Fahrenheit. And with all of the burgers, the meat that was tested, none of the McDonald's beef patties had E. coli. So in that regard, there was not fault as far as the preparation or the action of the McDonald's staff, McDonald's employees. What they did find was that those slivered onions that go in the quarter pounder, that's what had the E. coli. So then you may be thinking, ooh, maybe they put those onions by some raw meat at one of the McDonald's and maybe that's the problem. But no, because as I mentioned, it happened in 13 states. And all of the slivered onions traced back to their supplier of onions, Taylor Farms. Taylor Farms. And Taylor Farms does not only supply onions, slivered onions to McDonald's, some other fast food chains also. Pizza Hut is one, and there are others as well. Right now, I haven't seen them named in any of the class action suits. Right now, they're going for McDonald's, which again, should they be going after McDonald's or going after Taylor Farms? We'll put it in the chat. Put McDonald's if you think, yeah, they need to sue McDonald's, it's their fault, and put Taylor Farms or TF if you think they need to go after the people who actually, gave the slivered onions. But anyway, let's talk a little bit about E. coli, okay, and how one can get kidney failure from E. coli. Okay, so there's different strains of E. coli, and for some strains and ones that produce the Shiga toxin, they can lead to severe illness, which can lead to something like what this young lady had, kidney failure. And so I know that there's one particular strain, E. coli 0157H7, and it can certainly cause a bloody diarrhea. But one of the illnesses that can occur after having an E. coli infection, ingesting E. coli, is hemolytic uremic syndrome, or HUS. And I've treated this quite a bit when I was at Georgetown on my pediatric nephrology rotations, pediatric kidney disease. So it's the HUS is actually more common in children who are young, less than 5. This young girl was 15, still a child, which makes her a little more susceptible than a typical healthy adult. Very immunocompromised people can also be susceptible to getting HUS, or hemolytic uremic syndrome. What happens in HUS is that tiny blood vessels become inflamed, okay? They get damaged. And then you get blood clots in these tiny blood vessels, right? And so then that impedes or that slows down or stops blood flow. When you can imagine, if the blood vessels that supply the kidney become damaged or they get clots, well, then you can get kidney failure, okay? But of course, it can happen to blood vessels all over the body. And symptoms may include bloody diarrhea, which it sounds like she had, vomiting, severe abdominal cramps, which she described as well. And you can also get unusual bleeding, like bloody nose, bleeding gums, and bruising easily. And that's because you can also have hemolysis, or the breakdown of your red blood cells, okay? So you can get anemic, or you can also get the breakdown of your platelets. So you get low platelets or thrombocytopenia, okay? And then uremic, that's kidney failure. So hemolytic uremic syndrome is something that can occur from an E. coli infection, which in this case, it looks like occurred from eating contaminated slivered onions. So what do you do? Okay, how can you keep yourself from getting E. coli? Well, definitely you want to make sure you don't eat undercooked meat, which again, in this case, that wasn't the case with the quarter pounder. It wasn't the patty. But if you cook, make sure the internal temperature of your meat is at least 160 degrees. You also want to make sure you keep raw food away from cooked food, right? So you don't want to have raw meat sitting there right next to your broccoli or your onions, where the raw meat, the blood, the juices is flowing. The juices are flowing. You don't want that to happen. You want to make sure you're cooking or eating food that's prepared on clean surfaces, clean utensils, things of that nature. Also, E. coli can be found in unpasteurized milk and unpasteurized juice. You want to avoid that. Ooh, and you also don't want to swim in contaminated water. Okay, I don't want to be gross, but look, this is a medical professional channel, so I have to tell you like it is. If you're in a swimming pool or a lake, and there is human excrement, okay? If someone, like say there's a baby swimming in the pool or a child, someone has a bowel movement in the pool, okay, feces in the pool, of course, E. coli, and we talked about this last week on the live, E. coli is in feces, it's in stool. And so if you're swimming there and that makes you ingest that water, that puts you at risk. Okay, real talk. I know y'all have been in the pool where all of a sudden everybody has to get out of the pool and they clean and disinfect the pool. Well, that's why, because swimming in contaminated water is a risk factor for E. coli infection. Interestingly, another risk factor is if you're someone with GERD, gastroesophageal reflux disease, or heartburn, which is super common, then you take these medicines oftentimes, right? Proton pump inhibitors, omeprazole, Zantac, Prilosec, Pepcid, all of those. Well, that helps to decrease the acid in your stomach and keep you from getting the heartburn symptoms. That's good, right? Yes, it's good for heartburn, but acid is also protective, right? If you have a normal amount of acid, that will help to kill bacteria like E. coli. So if you're someone who takes those medicines regularly, like the Nexium and whatnot, then that could actually put you at risk for getting something like an E. coli, because you don't have the acid to help. You don't have enough acid to help, get rid of E. coli. Just one of those risk factors. But basically, so we talked about the symptoms. We talked about ways to prevent it, what to avoid. And then, of course, the treatment depends on your symptoms. In her case, she had kidney failure, and so she actually needed dialysis. All right. So if you have any more questions about that, then we can try to touch on them at the end for the live Q&A. But did anyone comment, of the med heads, anyone say that it's proper for McDonald's to be sued in this case, or should they get Taylor Farms, the supplier of the onions, or should they just leave everybody alone? And oh well.
No. So some mixed reviews and interesting thoughts as well.
What?
So quite a few people are saying both, Miss Beverly.
Okay, Miss Beverly. Okay, both. And then I'm curious if anyone else put any comments, because surely, them doing the class action suit against McDonald's, what is it about McDonald's that how could they have known, right, that there was E. coli in the slivered onions? Or it may just be the case that McDonald's has the money and McDonald's doesn't want their brand tarnished. Maybe they feel like they have a better chance of McDonald's doing a settlement and saying, okay, we're not admitting to fault, but we're going to give you this and go away and sign this that you won't badmouth us in the media. That might be worth it. I'm not a lawyer, but McDonald has the big pocketbook. Who else?
So Unique View. Hello. First time joining, she said.
Welcome. Glad to have you.
So McDonald's, and they should sue their supplier.
Interesting. Okay. So McDonald's, so you think she's right in suing the person with the big pocketbook, McDonald's. And then because Taylor Farms sent those little old infected E. coli infested slivered onions, the McDonald's has a suit against them for putting them in a position where right now it's all over the media. That's interesting. So I'm wondering if it would go that way, or if McDonald's would just be like, don't sue me, sue them. Oh, that's going to be interesting. I'm going to look. I need to talk to some of my legal friends. I like that Unique View.
Okay. Pass it up, maybe a little bit of that going on.
Okay.
Keela says TF root cause. They are the root cause. They should be sued.
Okay, so you believe that TF is at fault. So yeah, Taylor Farms, I do feel like Taylor Farms is at fault because, we know that it's not just a McDonald's problem, or else what? It would just be one McDonald's, one state, right? If one McDonald's made the mistake. But the fact that it occurred in 13 different states, all of which had Taylor Farms slivered onions, we know that Taylor Farms is at fault, right? Not McDonald's. McDonald's has the big name. McDonald's served the burger. It's going to be interesting. I still feel like McDonald's is going to have to come up some money. I never heard of Taylor Farms. I'm sure they're not broke. I ain't messing with no broke, but they probably don't have McDonald's money. But this is going to be interesting. I will say for McDonald's, I feel like they were transparent. Okay. The president of McDonald's has been on different news networks and basically saying that, of course, they're sorry that it happened, but expressing that it wasn't anything that they cooked. It basically saying, it's their fault, Taylor Farms. They didn't say Taylor Farms' name in the interview I saw, but they did pull the quarter pounder off the menu right away. They pulled the slivered onions. Now quarter pounders are back on the menu. And at least as of last week, they weren't putting slivered onions on the quarter pounders. What they have done, they also have diced onions. If ever you had the McDonald's regular burger, it wasn't in the diced onions. It was only in the slivered onions that came from Taylor Farms. But anyway, McDonald's is doing their best to get ahead of the story. All right, we'll move on to the next story. Anyone else comment on this before we go?
No, just it's out of both saying both should be sued, or Taylor Farms directly.
Yeah. Okay. This will be interesting to hear the fallout. But, I pray that young girl, the 15-year-old, gets better and that she recovers and that she doesn't have chronic kidney disease. But she and her mom are right on. It's very possible that she can have a lifelong health issue due to the quarter pounder that she ate with the contaminated onions. Make sure that after you finish watching this live, check out my Instagram at dr.frita. I have different content on Instagram than I have on YouTube. And I actually did a short form video where I go into detail on E. coli and how it causes kidney failure. So it's some information that you can share, especially with people who eat a lot of, fast food. Just share that information with them. And if anyone suspects that they might have an E. coli infection, contact your doctor immediately. Okay. So now let's talk about Rachael Ray. Rachael Ray. We know that she has her cooking show, and she's been in the headlines because fans have reported that she's had some slurred speech, right? And they've been suspicious, like, is it substance abuse? Is she drinking alcohol? Is she doing drugs? This is not what I'm saying. These are some of the comments she's been getting. Or is she sick? Has she had a stroke? So she was doing she was talking and doing a cooking show and talking about some dish, and they said in this particular video that this is where the slurred speech was. So let me see. Shador, we have a couple of clips. Let's do the one that I sent most recently. If you have that one up, where they talk about what fans are saying about Rachael Ray.
Okay.
Commenters on a recent video featuring Rachael Ray think something was wrong with the celebrity chef, expressing concern and vitriol. But should people really be worried, or are they just making assumptions? At the end of August 2024, Ray posted an Instagram clip from her FYI show Rachael Ray in Tuscany, in which she's cooking up a delicious pollo al matone.
Winner, winner, chicken dinner.
Unfortunately, very few of the comments are about the dish. Instead, many focused on some commenters' belief that Ray was slurring her words. One even took it a step further, writing, "OMG, please get her help for alcoholism. She looks and acts drunk all the time." Others made scathing comments about Ray's supposed weight gain. A few seemed genuinely concerned for her health and feared she may be dealing with an illness. Ray didn't respond. Instead, she simply posted another clip from her show, this one of an osso buco recipe. That comment section was also flooded with similar statements. One commentator wrote on that one, "I think it's a mini stroke. Part of her mouth seems to be sinking." Another commenter said that Ray's mouth had always had a natural slant, but then counterpunched, repeating the contention that Ray had been drinking. Another even urged her to work on her hair and makeup so she didn't look like she had just woken up. It's worth noting that people have been theorizing that Ray has substance abuse issues since she was on Food Network, and have shared those opinions on Reddit and elsewhere. Some of Ray's fans, though, wouldn't stand for what they saw as rampant speculation about the host's well-being. One fan defended her by writing that she was allowing herself to age gracefully instead of trying to alter her appearance with plastic surgery. Another commenter offered a similar sentiment, writing, "She's aging like the rest of us. Maybe she has a medical condition. Maybe she is on medication. Regardless, no need to be mean." Yet another commenter said whether Ray had some drinks or a health condition of some kind is not fans' business, writing, "Knock it off. Rachael Ray is doing what she wants, and she's happy. Whatever she'd like to cook or change, that's her business." Ray's reps didn't even seem to want to dignify the comments with a response, with one simply telling TMZ, "No comment." Ray herself has made it clear that she simply doesn't understand why people would want to comment negatively about someone's appearance. She said on the No Limits podcast in 2018,
I feel sorry for people that do. I just don't think that that's a skill anyone needs. Why would you put negative energy into the universe?
Ray also told host Rebecca Jarvis that she didn't concern herself with haters because they had no positive contributions to her life. Instead, she chose to tune into the voices of her fans because they were the ones who made her the massive success that she is. Ray said that she wasn't overly concerned with being adored either, because she felt tremendous contentment in her professional and personal life. Ray has been plenty open about her ups and downs in life, and she has never stated that addiction was a part of it. However, she has been candid about the speech issues that have led to her distinctive voice sounding like it does. In a 2006 interview with People, Ray said, "I lose my voice a lot. I had a lot of croup as a kid, so I don't have the strongest vocal cords to begin with." In 2008, Ray's rep announced she had to undergo throat surgery to remove a benign cyst on her vocal cords. At the time, her rep reassured people that it was a minor procedure and she would be fine in no time. Given all that, it seems like the speculation about Ray's health is just that. She has always spoken candidly about her struggles whenever she has felt comfortable.
Okay, so that's just the case of people being mean. You have sometimes people who troll and they do it under what I call a faux concern, okay, like fake concern, when really they just want a chance to be mean. Okay, so speculation about substance abuse, there's no proof. She's never said anything about substance abuse. So what they're talking about with the alcoholism, this, that, and the other, they have no proof of that, people. And then stroke, her people haven't shared if she's had a stroke. That's not clear either. We don't know if she has any kind of medical problems. She did share that she's had some falls, and she says because she's very active and hands-on, she kind of competes with her husband and bringing in wood and doing all these things. She says she's very active, but that's just kind of an update. They're talking about Rachael Ray and specifically the slurred speech. And if y'all could just put in the chat, what are some things that can cause slurred speech? And then we'll hit on that a little bit. But first, let's hit our last story, our last health topic in the headline. And that's Megan Thee Stallion. She's sick of y'all. Okay. She's sick of y'all messing with her. And she actually shares in a documentary that she just put out where it's in her words. Okay. And she talks about dealing with the death of her mother, dealing with the whole Tory Lanez situation and mental health. So let's see. Do we have a clip or do we have a photo, Shador?
Yeah, I have a photo up for you.
Okay. So yeah, so we know Megan Thee Stallion, very popular right now, female rapper, owns her sexuality. She's like, hey, you know, what if you don't call the boys, the men folks names for being, you know, for owning their own sexuality? She's not accepting you calling her any names. So, you know, I've seen her in concert at the One Music Fest. Love Megan Thee Stallion. And she's actually been through a lot. We know that she is an educated young lady. She graduated from college, and she and her mother were very, very close. In fact, her mother was her manager at one point, and her mom used to be a rapper. And so it was believed that her mom was kind of really enjoying managing Megan and living out her dreams through Megan. They were close, close, close. And, you know, you have reports of when Megan was performing, her mom was giving her tips and telling her how to breathe as she rapped, as she performed. But Megan shares in this documentary that her mom, who has passed away, got ill, and it was somewhat of a sudden illness. She said that her mom, you know, had called her and was like, you know, I can't find my words, like, you know, there's some confusion going on. And so then, of course, you know, Megan said she was trying not to freak out on the phone. Megan was trying not to freak out because she didn't want her mom to freak out, but she knew that it was serious and she needed to take her mom to the hospital. So of course she did. And what she learned was that her mom had a brain tumor. And then Megan Thee Stallion said it seems like very quickly she ended up going into somewhat of a coma, how she describes it. And it became clear to Megan in not that long of a time period that her mother's life wasn't really living at that point. She lost her quality of life and her ability to really be able to communicate. And so I have not seen the whole documentary, but it sounded like Megan had to make some difficult end of life decisions for a mom who went through an illness suddenly. So she talks about the effect that that had on her mental health, the loss of a parent at a young age, because Megan Thee Stallion is still in her 20s right now. And so her mom was her person. And then we know about the Tory Lanez controversy. And in the documentary, you'll hear her talk about how her sexuality really became a heavy part of a discussion. And so she admits to having told a lie when she was being interviewed by someone who asked if she was intimate or romantic with Tory Lanez. And initially she was like, no, because that's not what they were supposed to be talking about. They were talking about whether or not he shot her. But then when she actually was testifying, she was honest. She did not lie on the stand, apparently, that she said, you know, I slept with him once, maybe twice. That's how she put it, you know, but either way. So then you have people now in the Tory Lanez camp questioning her credibility. For those of you who aren't familiar with the story, after you finish your live, you'll be able to Google it, where Tory Lanez, I'll say allegedly, shot her in the foot, but he was actually found guilty of it. So perhaps it's not alleged anymore. Okay. But people have still come at her. A lot of rappers and hip hop artists and just people in general have just come at her and saying, we don't think Tory Lanez did it. We think you're lying. She really has taken a lot. So basically she talks about mental health. And it's just a reminder for anyone who's dealing with mental health issues, which heck, everybody has. Mental health is just health. Either your mental health is good or your mental health is questionable. But if you're dealing with mental health issues, make sure you reach out, consult with your doctor, consult with a psychologist or a psychiatrist, because certainly if you're dealing with major depressive mood disorder, then you may even need some medications, and a psychiatrist is able to prescribe medications. And just kind of for some symptoms, if you're having, you know, low mood and inability to experience pleasure or anhedonia, that could be, you know, a symptom of depression. If you're having sleep changes, either insomnia where you can't get to sleep, or hypersomnolence where you're sleeping all the time, change in your eating, if you're eating a lot more than normal, or if you have anorexia, not anorexia nervosa, the illness, but if you just aren't eating, then that could be a sign of depression. It's very common, we're finding. And certainly if you have any thoughts of hurting yourself or taking your own life, you want to get in contact. And we have a helpline, which we can put in the description or even put up, of a helpline if you're having thoughts of hurting yourself or if you need to reach out. So just kind of do a little screenshot here if you or a loved one needs some help, if you're dealing with mood disturbance. But yeah, check out Megan Thee Stallion's documentary, where she apparently is really just out there and bold, with her information and really trying to help with mental health and get rid of the stigma. All right. So it's time to wrap up this Medical Monday. We hit on a lot of topics, but before we slide out of the door, we'll do a couple of questions if y'all slip some questions in. Again, remember, if you want to do a session where we have an entire session of a live Q&A, we have a members only once a month. Click the link in the description to join that. Or if you want to do a one-on-one consultation with me, I do offer a telehealth concierge service where just you and I, one-on-one, uno a uno, we can have a conversation about your health. I'll take a full history and I'll give you my medical information based on it. I've been having very great success because we can do the telehealth from wherever you are in the world. And I have had people outside of the country, inside of the country, all around the world who've taken advantage of this telehealth service where you just, for the entire session, we have a chance to talk and I just give you all of the evidence-based information, all of my insight from my years and years and years and years of experience. All right. And then, and make sure, I do have my book, Under Pressure, A Guide to Controlling High Blood Pressure. Make sure you can click the link in the description, or for everything, just go to dr.frita.com. You can also purchase it on Amazon, where I give really great information on lowering blood pressure, not just with medicine, but also holistically. But again, make sure you hit the like, share this video, and let's see, anyone have maybe just one or two Q&As we can get to, Shador?
Yes, yes, ma'am.
All right, let's see.
So the first one comes from Miss Belinda in regards to the young lady with the kidney damage from the E. coli.
Okay.
I wonder if she will have kidney damage long term.
It's hard to know. It's hard to know. I do know that she did have acute kidney injury. We used to call it acute kidney failure. And it was bad enough for her to have dialysis. So it lets you know how serious it was. Now, in some cases, the patients who get the kidney failure related to E. coli, in some cases they can recover, but depending on how damaged her kidneys were, it's possible that even if she's able to come off dialysis, she might literally have CKD, chronic kidney disease. And if so, it would have been the direct result of eating that quarter pounder. So the short answer is we don't know. I've had patients who've gotten off dialysis, but many of the patients I've had have had some form of a chronic kidney disease. So only time will tell. Only time will tell.
All right. On the track of kidney disease, Ms. V.E. Hall. Hello. She says, can CKD cause dry skin and itching?
Yes. Yes, that's the short answer of it. And especially if it becomes advanced, what's happening with the CKD. Now, if it's early onset, then probably not. But if it progresses to a CKD4 or even a CKD3B, a later stage where the kidneys are not filtering as well, then you can get a buildup of certain substances. One, for example, is phosphorus. Phosphorus, we find in all kinds of foods, especially, so you can find it in foods and, in fruits and in vegetables, but it's really in high amounts in foods that are prepackaged or processed, because phosphorus really serves as a great preservative, okay? And so these pre-processed packaged foods will have phosphorus. Well, typically when your kidneys are healthy, well, they get rid of the phosphorus, okay? So what? Eat your phosphorus, you get rid of it through the urine. Eat your phosphorus, okay, you urinate it out. But if you have advanced CKD, your kidneys are not able to get rid of the phosphorus as efficiently, and so you can get a buildup of phosphorus in your blood. One of the effects of high phosphorus in the blood, or hyperphosphatemia, is itching skin. And you ought to see my patients, especially my dialysis patients. If they're not taking their medicine that helps to lower their phosphorus, their phosphate lowering medicine, then you'll see just scratch marks where they're digging in their skin and miserable. I'll check their labs and I'll be like, yeah, your phosphorus is high. That means you're eating a whole lot of bananas, pancakes, packaged foods, milk can actually have high phosphorus. So the short answer is yes, CKD, especially advanced CKD, can cause an itching and even a dry skin. Check out my video after you finish this live. I have a few videos. In fact, just go to my playlist right here on this Dr. Frita channel. If you go to Dr. Frita and you pull up my YouTube channel where you're already on it, just go on up to the top and look at playlists. I have a kidney playlist. And in that playlist, I have a few videos on warning signs of kidney failure, or early symptoms of kidney disease, late symptoms. You'll be able to see the dry skin, itching, and many other warning signs of kidney disease. So check out their video and share it with the folks you care about. Thank you for the question.
Yes, ma'am. You got time for one more, so?
Let's do one more. Let's do one more.
All right, Dr. Frita. This comes from Miss Margot.
Margot?
Yes.
Hi, Miss Margot.
What is Zyrtec versus Mucinex?
Ah, very good, very good. Okay, so if you're someone who gets a lot of allergies, seasonal allergies, allergic rhinitis, congestion, then you might find yourself taking both of them, right? But for the Mucinex, as we discussed, that's guaifenesin, which is a medicine that actually helps to thin the mucus. Okay, it thins the mucus it can thin the mucus in your upper airway, sinuses, upper lungs, and it can help you to cough and get rid of that mucus better. So it's just a mucus thinner, basically. The Mucinex is. The Zyrtec, which is in the same line as Zyrtec, Claritin, loratadine, those type of anti-allergy medicines, where those are medicines that are actually going to help to decrease some of the substances that are released from your immune cells that will make you have symptoms of allergic rhinitis. So those medicines are not ones that are, the Zyrtec is not going to be just like a mucus thinning drug. It's going to be something that's going to help to prevent you from getting the itchy eyes, the running nose, the itching throat, the coughing, all the things that you get with symptoms of allergic rhinitis. And so oftentimes patients will take both if they're having allergies, plus if they're getting a backup of mucus from either not just having a cold, but just from having allergic symptoms that are making them have more mucus. Okay, so the Mucinex helps to clear to thin the mucus. Okay, it helps to thin the mucus, whereas the Zyrtec helps you to get rid of symptoms of seasonal allergies or allergic rhinitis.
All right, thank you, Dr. Frita.
Yeah, some people actually use Zyrtec even if they don't have allergies. For some folks who like will go walking or jogging, they'll get itching, right? Okay, they'll get itching. Yeah. Have you ever experienced? I've experienced that, especially if I haven't gone running in a while and I decide to just go running and it'll make me just itch and I just look and everything just starts looking dirty and itchy and crawly. Well, the Zyrtec in some of those cases can help to prevent you from having all that itching because they have an effect on your histamine release. And histamine is something that's released from your mast cells and it can cause a lot of things. Mast cells are typically great. Okay. They're part of your immune system. They help you to get rid of infections, but they can also exacerbate symptoms of allergic rhinitis, and they can even cause itching, okay, or hives. And so the Zyrtec can help with that also. And of course, Mucinex would have nothing to do with itching. Yeah. Check out, I think just last week on this live, once you finish this live, check out the replay on our last live where we talked about MCAS, the mast cell activation syndrome that Solange Knowles has shared that she has. Yeah. Okay. That's it for today. What you got? You want one more?
You know I love to answer these questions.
Okay, one more for the road. And then for y'all who want to get your questions in, join the membership and we'll get all the questions in back and forth for the entire session, however long, it takes within a reasonable time to get the questions done. But that's what we do for the members only. And for those of you on here who are members, you remember and you have access to the members only videos. We really do go back and forth the entire time for Q&As. I love the Q&A section too. But we'll do one more for real and then we'll get out of here. Okay.
All right. This comes from Sheree.
Hi, Sheree. Welcome back. Hey, Sheree.
Hey, so Sheree says, if you get a virus or food poisoning, is there a way to start protecting your kidneys immediately to improve an outcome?
Oh my goodness. Okay. So first off, if you have something like a food poisoning, okay, gastroenteritis, let's just take E. coli specifically, then you usually won't even have symptoms until 3 to 4 days. You can get them as early as a matter of hours or a day or as much as a week. But as soon as you get the symptoms, one of the great ways is to stay hydrated. Now, in a case of hemolytic uremic syndrome, where the blood vessels are actually damaged, then it's really going to be a matter of getting into the hospital to get treatment. But if it's a food poisoning where it's really just causing you a watery diarrhea and causing you vomiting, the best way to prevent the kidney failure there, if you cannot keep anything down, get to the hospital where they can give you IV hydration. The IV hydration is a great way to preemptively prevent kidney failure in that case, when it's just a matter of you being dehydrated. Because we know that dehydration from vomiting, nausea, and not being able to keep food down, the dehydration can cause something called pre-renal azotemia. And if you stay hydrated, like you're sitting at home, it's been 3 days, 4 days, you're not eating, you're not drinking, you're having diarrhea, and you're vomiting, well, if you continue to have this dehydration, that pre-renal azotemia can actually then transition into ATN, acute tubular necrosis. And in that case, it may even require dialysis. So the best thing to do is to go into the doctor and be your own advocate, okay? Because if they say, oh, you're fine, just go home. If you cannot keep food, I mean, if you cannot keep water down, if you cannot keep hydration, then stress, I cannot hydrate. Whatever I eat or drink comes up. Please give me IV fluids. Be your own advocate, speak up. Because even with this little girl, you see, she was having bloody diarrhea and they sent her home and they're like, oh yeah, you had a bug. A week later, she's still having the vomiting and diarrhea. She went back and then she had kidney failure. You know, hindsight is 20/20, but I'm just wondering, and I don't know, I'm not the physician. Maybe there was no indication at the time for them to admit her, but I just wonder how much of her kidney failure was from a whole nother week of dehydration. So yeah, the short answer, and of course, consult with your physician. What I give you is just informational. It does not replace the advice of your physician. But the short answer, as far as what's in your control after you already get the gastroenteritis or the viral or the bacterial food poisoning, what's in your control is hydration. Hydration, hydration, hydration. If you can't do it at home, do it in the hospital and be consistent in making them give you IV fluids. Good question. Yeah. And remember, check out my video that I have. It's on my Instagram at dr.frita. It's the most recent one that's on there. And it says on there, 5 things to know about how E. coli can lead to kidney failure. And I go into some pretty nice detail for it to be short form content. So check that out.
Yeah, absolutely. To close out, Dr. Frita, Margot, when did you do members only?
Oh, okay. So far we've been doing them once a month at the end of the month, and we've been doing them right after one of these lives. But for my members, make sure you reach out because we are going to try some different time slots to see if we can, find a slot that most people can catch. And so, Margot, hey, if you become a member, come on, join us, become a member, give us a suggestion and we'll check it out. We'll see if we can accommodate and we'll see how the members are able to watch it. Here's a good thing. Even if you're not able to attend the live, it's more fun when you attend the live yourself though, right? Because you can give follow-up questions and Shador and I just go back and forth, child. So even if you can't attend the live, if you go ahead for members, if you send me the questions ahead of time, you will, whether you attend the live or not, have access to that video. I save the videos for my members only. And so say we do a time that you can't make, put your question in, and then we'll answer that question. And when you come back, you'll see it. But yeah, right now we've been doing it at the end of the month on the Mondays, right after this live Q&A, but I'm flexible to try different times. Come on and join us. Come on and join us. I'm telling you, we have a good time. And beyond that, I give evidence-based information. I have decades of experience at this point. Oh, how old am I? Oh, my birthday is this month. I don't want to talk about it. But I have decades of experience and I love what I do. And I really do share information that, we're having some pretty great success. And let me give a shout out. We're going to get out of here. A shout out to Funky Dineva. For those of you who've been with us for a while, you will recall that I was on his show. He's a mess. He's so fun. I was on his show talking about BBLs, right? Brazilian butt lifts. And I was talking about the dangers of BBLs and the fact that they are the most fatal of all the cosmetic surgeries. And then I was saying for people who do want the BBLs, because I understand folks who want to improve their aesthetics. I talked about the safest way and, seeing a board certified plastic surgeon. I talked about medical tourism when people go to other countries, to Mexico, to Turkey. I talk about, the things. But anyway, we had a good conversation. And people who saw me on Funky Dineva have been coming now as patients and taking advantage. And so I don't even know what made me talk about that. Oh, yeah, I just want to give a shout out to Funky Dineva and to the Funky Bunch. I'm a member of the Funky Bunch. Yes, because I appreciate the support. Yeah. All right. So with that, Shador, look, Shador, I know you want to sit here and take every question. We'll catch the other questions for the members only now. We can't do all the questions, but y'all, I thank y'all so much for joining us for your weekly dose, for the myth versus fact, and for all of the hot health topics in the headlines. I am Dr. Frita with my co-host Shador. This has been Medical Monday. Make sure you come back and join us on next Monday. We'll be here every Monday at noon Eastern Standard Time. And for those of you who want a little bit extra, a little bit of the VIP perks, go ahead and click the link in the description and join us for members only. And make sure you vote, okay? This is my shirt. Voting, 100% more effective than complaining on the internet. If you have not done your early voting, please make sure that you vote on tomorrow, on Tuesday. Your voice matters. If you sit home and say, I ain't voting for either one, I don't want to do it. If you don't vote, you're allowing other people to control your destiny. All right. Thank y'all for joining, and I'll see y'all next week on Medical Monday. I'm Dr. Frita.